Hello. It is my great honor to welcome all of you to ROC, Reach Out Centre for Kids in beautiful Burlington, Ontario, for an exciting announcement for Community Children's Mental Health Services. My name is Kristen Dougherty, your MC for today's event, and I have the privilege of being the CEO for ROC, Reach Out Centre for Kids, which is the lead agency for community child and youth mental health services in the region of Halton. As we begin, I would like to first acknowledge the land on which we all gather this afternoon. Reach Out Centre for Kids is deeply connected to the land on which we gather today. We have supported children, youth, and families on this land for 50 years. We respectfully acknowledge that this land is situated on the traditional territory of the Anishinaabe, Haudenosaunee, and the Huron-Wendat, and is home to many First Nations, Inuit, and Métis people. We also respectfully acknowledge and are deeply grateful to the current treaty holders, the Mississaugas of the Credit First Nations, for sharing their traditional territory with us so that we can support children, youth, and families on their journeys of healing. As we gather today on these treaty lands, we will honor and respect the 4 directions: land, waters, plants, animals, and ancestors that walk before us, and all of the wonderful elements of creation that exist. What you will hear from the minister very shortly is a much needed, much appreciated investment that continues to demonstrate this government's commitment to the child and youth mental health sector. As co-chair for the Lead Agency Consortium for Child and Youth Mental Health Services for Ontario and co-chair of the Ministry of Health funded single session therapy platform One Stop Talk, Parlons Maintenant, I have had the privilege of being involved in a number of significant and impactful system changes. Programs like One Stop Talk that have and will continue to have impact because of this government's willingness and commitment to partner with the sector to identify and implement solutions. Solutions that will make a difference for the children, youth, and families we serve and across the mental health system of care. And now for the moment we've been waiting for. It is my privilege to introduce to you the Deputy Premier and Minister of Health, the Honourable Sylvia Jones.
Well, thank you, Kristen, and good afternoon, everyone. It is indeed great to be here at Reach Out Centre for Kids alongside my friend and colleague, MPP Natalie Pierre, a champion not only for her community, but even before serving at Queen's Park for youth mental health. So it's really great to be able to be here with you, Natalie. As well, of course, as Tatum Wilson, the CEO of Children's Mental Health Ontario, and a tremendous partner who has been a tremendous partner in creating more connected and convenient mental health services across Ontario, to share how our government is continuing to make it easier for children and youth to connect to the mental health services they need, where and when they need it. I also want to thank the entire team at ROC for hosting us today and for everything that you do every day to support children and families in your community. On Bell Let's Talk Day, Ontarians are shining a light once again on mental health, breaking down stigmas and sharing their own stories. Our government knows mental health challenges can impact individuals of all ages, and we recognize the tremendous work of numerous organizations and community members from across the province who are helping address these challenges by listening and reaching out to young people to connect them with the mental health services they need. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Since 2018, our government has increased investments in supporting youth mental health by over 25%. And through our Your Health Plan, launched last year, we are continuing to make it easier and faster for individuals of all ages to connect to world-class mental health and addiction services and supports, building on our roadmap to wellness, to provide high-quality, evidence-based services while introducing new and innovative programs to ensure access to timely and appropriate services. Earlier today, we celebrated the opening of a new youth wellness hub in West Toronto, a welcoming space for children and youth in the region to access convenient and comprehensive mental health supports. Since 2020, our government has in fact opened 22 youth wellness hubs in communities across Ontario, connecting over 40,000 young people to mental health and wellness services close to home. Today, I am pleased to announce that our government is continuing to build on our progress to provide Ontarians of all ages with the right care in the right place by investing up to $44.6 million to connect even more children and youth to mental health services in their community. This funding will deliver new and expanded community-based intensive services and support initiatives such as Help Ahead, One Stop Talk, and the Complex Transition Fund expansion. This consistent and stable annualized funding increase will also give community-based child and youth mental health providers the resources, staff, and technology to expand and improve access to complex mental health care service and reduce wait times. The funding announcement of today is part of our government's historic investments of an additional $330 million each year in pediatric healthcare services at hospitals and community-based healthcare facilities, launching over 100 high-priority initiatives in every corner of the province to connect children and youth to emergency care, surgeries, ambulatory services, diagnostic imaging, and of course, mental health services. Today's announcement is yet another way our government is taking bold, innovative action to build a healthcare system that puts people at its heart. We will continue to work with our health and community partners, making significant investments in hospital and communities to improve how they deliver pediatric care, ensuring Ontarians of all ages can access care easier, faster, and closer to home in their communities now and for decades to come. Thank you again for your incredible healthcare workers and everyone working in the pediatric mental health sector. I'd now like to turn it over to Tatum Wilson to share a few words. Thank you. Stay well.
Thank you so much, Minister Jones, for sharing this important announcement today here at Rock Reach Out Centre for Kids. My name, as the Minister said, is Tatum Wilson, and I am the CEO of Children's Mental Health Ontario. It is a privilege to be here on behalf of the 85 community-based child and youth mental health agencies that CMHO represents, in support of the 140,000 children, youth, and families our sector serves each year. Today represents an historic step forward for our sector, and with both gratitude and a spirit of celebration, I want to personally say thank you for this investment in community-based child and youth mental health care, one that will begin to address a long-standing and urgent gap in treatment for children, youth, and families with intensive and complex mental health needs. 3 years ago, a unique collaboration was started where Ontario's 5 pediatric hospitals and our community-based child development and rehabilitation and mental health partners came together to say that we need to make kids count. Too many kids were waiting too long for services for their physical, developmental, and mental health, and sadly, in many cases, waiting longer than adults. This is why we were so grateful that in July of last year, the Premier and Minister Jones announced a new investment to begin to right-size the children's health sector. In the area of child and youth mental health, we know that kids are waiting too long, and for those with intensive need, the wait and the impact of that wait is even greater. And in some parts of the province, like northern, rural, and remote communities, services for kids with intensive needs simply do not exist. And these gaps in care and barriers to accessing it are even higher for Black, Indigenous, racialized, and other equity-deserving communities who are known to already be at higher risk of experiencing mental health challenges. That is why when the money was announced in July, the leaders in our sector proudly rolled up their sleeves and got to work on designing this new model of care, a provincially guided, regionally coordinated, locally delivered intensive treatment model that will maximize the capacity for our system to meet the needs of children and youth in the province. It will begin to address long-standing gaps and better integrate and connect care, all while focusing on the needs of the child or youth and their family. This is why today's announcement is such a significant step forward. After many years of underfunding, respectfully across governments of all stripes, today's investments, as well as those made in recent years, will begin to move the needle on building a system of care that means more children, youth, and families, no matter where they live or how complex their needs are, will be able to receive the care and treatment they need when and where they need it. This system transformation, when fully implemented, will provide faster access to high-quality, community-based care and treatment, and a better and smoother patient experience for families and service providers. It will help kids and families better manage their conditions, participate more fully in school and all aspects of life, and to feel fulfilled and to thrive. And while there has never been a question about the moral imperative to improve access to mental health care, today's announcement will also address the economic imperative. By providing faster, higher quality care in the community, it prevents the need for more expensive and arguably less appropriate care in the hospital. To be clear, this will not solve all the challenges we are facing in child and youth mental health. There are significant challenges we must continue to navigate in partnership. Health human resources being a big one, as well as funding for those who work with infants and young parents, and for kids involved in youth justice. Our system still isn't set up to provide the type of culturally appropriate and identity-affirming care that we know would benefit so many. But we look forward to working with the Minister and our team on those things going forward. So today is about saying thank you. It's about being optimistic. I'm hopeful that we'll look back on today as a turning point, one where we've recognized that by collaborating across sectors, working hand in hand with government, and by building on the local capacity of our hardworking community child and youth mental health agencies, we can imagine an Ontario where children and youth are given the opportunities to thrive. We're all better off when that happens, and we're one step closer to that goal today. Thank you again, Minister.
All right, we'll now move to take questions from the media. As a friendly reminder, the format is one question, one follow-up. If reporters present want to line up behind me at the microphone, please state your name and your outlet before your question.
Good afternoon, Deputy Premier. Jason Gadola with CHCH News. It's budget season. Municipalities are in the thick of things right now. Municipalities, for example, like the City of Hamilton, they're considering, or they're deliberating over a proposed property tax increase of nearly 8%. Mayor Andrea Horvath is saying that likely they're not going to be able to meet all of their obligations due to, obviously, provincial-related costs are playing a role in that. In a nutshell, for lack of a better term, is it time for the province to start maybe handing out bailouts or earmarked cash for certain services to help cover those costs so they don't, because they're not mandated to run a deficit?
Well, I'm certainly not going to speak for Mayor Horvath, but what I will say is the government is very much a partner with our municipal leaders. We have invested, whether it is in infrastructure through the OSIF, Ontario Community Infrastructure Program, whether it is through policing, whether it is through municipal affairs and housing. We are there as a partner because we understand that we need to be able to keep our communities healthy. We need to be able to expand our infrastructure, whether that is roads or bricks and mortar, to allow us to build more homes in the province of Ontario, and we'll continue to do that. These are mayors and municipal leaders in their own right who have care and control over substantial municipal budgets, and we'll continue to work with them on issues that are of a provincial priority and a local concern. I will highlight one as an example. Mobile crisis intervention teams, which are mental health workers embedded with police officers to go out into community and assist people before they are part of the justice system, is a program that is in place and has been expanded many times in the last number of years because we see the need in community. The ability for us to work with those partners and see where the needs are. Of course, I will highlight ambulances and paramedics. The province is a 50% partner in any new hiring that occurs in that sector. So we'll continue to be a partner and work with them. We've just, of course, finished 2.5 days of the Rural Ontario Municipal Association meetings, where we were again sitting down, meeting directly with those municipal leaders to hear where their priorities are and where they align with provincial priorities.
Right, and well, the City of Hamilton's already talking about dipping into reserves, which is a territory they're trying to avoid, and it still doesn't seem to stop what is supposed to be almost an 8% property tax increase that they're likely facing. So what would you say to the residents of Hamilton who may be struggling to make ends meet, having to deal with those high property tax hikes at this point in time?
Well, I would say that reserves are property tax appropriation that has already happened. That is money that the individuals of Hamilton have already given to their municipal leaders and their municipal government, and I think it is important that they make use of the tax dollars that they already have, whether that is coming in the year ahead or the reserves that they have in place. Thank you.
Hi, Minister. Laura Stone, Globe and Mail. I wanted to get your reaction to the federal court's decision on the Emergencies Act yesterday, having supported the federal government's use of that. Do you disagree with the decision, and do you support the federal government's decision to appeal that?
So I will leave it to the federal government whether it is my understanding that they have signaled that they intend to appeal it. Look, some of those impacts that were happening in our community, whether it was in Ottawa or in our border communities, had very direct and serious impacts, whether it was economic or socially. Individuals who couldn't access, we had ambulances and fire trucks who literally could not go on certain roads. So something had to be done, but I will leave it to the federal government on whether they wish to appeal and how they will do that.
Looking back and having seen some of the remarks made during both the inquiry and yesterday's decision, saying the province did have measures at its disposal that it didn't use, do you think the province could have done more and should have done more at the time in order to prevent the use of the Emergencies Act?
So I think we worked very closely with both municipal leaders as well as, of course, enforcement, whether that was OPP or city police. And we did put some additional measures in place, including some new legislation that ensured going forward we could not have blockades that were going to impact our ability to access critical infrastructure or our border communities.
Hi, Minister. Just to follow up on that, the Premier had said that he stood shoulder to shoulder and the government stood shoulder to shoulder with the Prime Minister on the use of the Emergencies Act. I'm wondering, did your government believe at the time that the use of the Act was constitutional?
What we believed at the time, and I continue to see as a critically important piece of this, is we cannot have communities held hostage and not have access to critical infrastructure. Again, whether that is fire, whether that is ambulance, whether that is access to our economic partners as we were trying to deal with trade outside of Ontario. So we worked, and I continue to believe that we need to ensure that demonstrations don't impact communities in a very visceral way that impact our economic and our social pieces.
Okay. And just on another topic, the international student cap, I'm wondering how concerned you are about Ontario's ability to bring in nursing or medical students internationally. What is being done by your government to ensure that this cap is applied evenly or in a reasonable way? Because it seems like universities especially are saying that they're going to be impacted in a really negative way. What's the government doing to make sure that nursing and medical students can still come in and that this won't prevent them from being able to enter the province?
Yes, Minister Dunlop has issued a statement on the federal announcement from earlier this week. Listen, I will say in my role in health, we did direct the College of Nurses of Ontario to quickly assess internationally educated and trained nurses in particular who want to come and practice in Ontario. And as a result of that ministerial directive, we saw a historic number of nurses who were internationally trained being able to get licensed in the province of Ontario. So I will work very closely with our regulatory colleges to make sure that we do not have a backlog of critically important health human resources, including in the mental health space, to ensure that they are not languishing and waiting for months and in some cases years to hear whether they will ultimately have the ability to practice in Ontario and get that license.
All right, that concludes our media availability. Thank you everyone for attending. If I could just get the speakers to stay up there for a group photo, that would be great. Thank you.